I'm Dr. John Wrench. I'm the Director of Radiology for St. Ynez Cottage Hospital. I'm actually the Chief of Radiology here. Radiologists are physicians who are engaged in patient care. We're the ones who interpret your imaging studies and confer with your doctors about the results. Well, the CT scanner is one of the most commonly used pieces of equipment in the hospital, period. We did about 4,000 scans in 2019, and it's used most commonly for patients with abdominal pain and stroke out of the emergency room, but also used quite a lot in diagnosing and following up patients with cancer. I would say it is possibly the most important piece of equipment in the hospital. One of the things that we're looking forward to is being able to do perfusion imaging in suspected stroke patients. Perfusion imaging is very important in trying to determine how much of the brain and what parts of the brain are potentially at risk, to distinguish somebody who needs much more aggressive, rapid treatment from somebody who doesn't. And it just helps us triage patients with stroke faster and better. It will enable us to do CT angiography better and faster and more comfortably for the patient. In addition, we're going to have a new capability to do perfusion imaging, which will help our emergency room physicians and their consulting neurologists better select who is most appropriate for more aggressive stroke intervention. The existing CT scanner has a very noisy cooling system. It makes it very difficult to communicate with patients in the room, and that makes CT-guided procedures in particular, things like biopsies and image-guided injections, very difficult to do. One benefit is going to be the newer and better operating software, which is going to make the scans faster to perform, and it's going to make it a lot easier for the technologists to do the scans and to get them online for everyone to look at faster. Philanthropic support for our goal of raising $550,000 for this vital piece of hospital equipment is very important. I'd like to thank you for your support for this vital effort for our hospital.